Good morning, everybody. Thank you for joining us today. My name is Bas Forsterveld, and I'm the president of the PAGB and general manager at Great Britain and Ireland for Halion. I'm really delighted to welcome you all today on Self-Care Day, as we launch a new landmark report from Frontier Economics. If you could please all go on mute, because I can hear myself. This report showcases the economic impact of the over-the-counter medicines in the UK. And while it has been commissioned by the PAGB, I must stress that this report is completely independent. Frontier Economics is one of the largest economic consultancy in Europe. They carry out independent, credible and robust research and are used by government departments, financial institutions and leading tech companies. The report clearly demonstrates how the figures you will hear today were modeled and calculated. Dalip Singh, consultant of Frontier Economics and one of the authors of the report, is on the call and is happy to talk through the points he will show. Also joining us today is Michelle Riddles, CEO of PAGB, who will be presenting the findings from the report. After that, we have a panel discussion chaired by the eminent Dr. Hilary Jones. We will answer any questions during the panel discussions at the end. But please feel free to submit questions at any time using the Q&A functionality you will see in the right side of the Teams presentation. Farhanak, if you can move to slide 2. Before I hand over to Michelle, I wanted to detail the remit of the research to provide you with some context. At the end of the last year, the PAGB commissioned Frontier Economics to assess the impacts of OTCs in the UK. By OTC, we mean over-the-counter medicines, but also medical devices and food supplements that can be bought by consumers without a prescription. Frontier Economics focused on two questions. What are the current impacts of OTCs in the UK? And what are the potential future impacts of greater OTC usage? We wanted to look at these impacts in the terms of, firstly, how they benefit patients and consumers. Secondly, how OTCs impact the healthcare system. And thirdly, understanding the economic impact for the UK, really quantifying what PAGB member companies bring to the UK in terms of economic benefit. Part of the purpose of the report was to update the PAGB statistics which hadn't been revised since before COVID-19 pandemic. And we can all agree that a lot has changed since then. We also wanted to quantify data that hasn't been previously analyzed in this way. And what we discovered, I think, has been truly groundbreaking. We have some really exciting results to share with you today. And without further delay, I would like to pass over to Michelle, head of the PAGB. Michelle.
Great, thanks, Baz. I'm really delighted to be here to share some of the fantastic statistics that have come from the Frontier Economic Report. I'll just add at this point that all the data and calculations and references are detailed in the report, which is now available online. And as Baz mentioned, here at PAGB, we haven't had some of this data available before now, and we needed some of our previous assumptions revalidated in this post-COVID world, which is why we began the project with Frontier Economics at the tail end of last year. So let's take a look at some of what was found, and we'll start by looking at the consumer self-care impact. So work from this report shows that we have 983 million OTC products sold each year, which enable consumers to self-care in their own home and treat the symptoms of minor ailments appropriately and effectively. Now, that's equivalent to 1,870 packs being sold every minute. So let's just think about that. 1,870 products are touching our consumers every minute of every day of every year. And it's not just the adults, that's the teens, the children's, and all of the babies. All through illness, helping them prevent more serious outcomes or simply being used to maintain wellness and a healthy lifestyle. It's a pretty mind-blowing statistic. So now let's look at the prevalence of self-treatable conditions. Now, the slide is showing that 96% of people in the UK will experience at least one self-treatable condition a year. We have 67 million people in this country, and therefore 64 million people have at least one condition that needs treating per year. We also have another completely new statistic, which gives us the average number of self-treatable conditions a person has each year. On average, each person in the UK will have 4.2 self-treatable conditions a year. Furthermore, 43% will actually experience at least 5 self-treatable conditions in that year. So that's some really interesting statistics showing the prevalence of these minor illnesses. Just imagine if the products weren't available to treat this level of prevalence, and what would happen if those conditions needed treating via the NHS by GPs and A&E. So just seen the prevalence information, but we also know that 92%, that is 61 million, will self-care and use an OTC at least once a year to treat that condition. Now that's an awful lot of people. And in fact, 13 million people use OTCs more than 10 times a year to self-care and treat self-treatable conditions, which means that for every person using OTCs, they'll be buying 1.3 packs of OTCs every month. That's for the 61 million men, women and children using OTCs in this country. They will be buying 15.6 products per year. You can really see how wide the usage of this product is and how they touch almost every single person in this country at some point in a year, and for many, numerous times more. You may also be interested to know that the average spend on 1.3 packs per month is £4.50 for every person. So a really exciting statistic that we've never had available before, and perhaps one of the ones that I'm most excited about, relates to how many days a UK employee who used an OTC product was able to work each year when they would have otherwise happened to have to take those days off. From the survey work that took place, Frontier were able to show the following. Yes, that's correct. They found an average UK employees who used OTC products were able to work an extra 5 days per year, which they would have otherwise had to have taken off from being ill. So that's a pretty big number and higher than perhaps we anticipated. So this means that for the 33 million employed people in the UK, OTCs have helped avoid 164 million lost work days per year. It shows that self-caring really does make a difference to how people feel and activities they can take part in. And we'll come on to the economic savings that brings later. But the benefit goes beyond just adults who work, because of course, as many of you know, children also get sick too. And for those like me who've had children go into nursery, that can happen pretty often. And actually, we're often thanking our lucky stars that PAGB members' company products are available and out there to support us to get them into nursery. Of course, the data supports this, with 21 million people agreeing that by providing OTCs for their dependents to treat minor illnesses, it allows them as adults to miss fewer days of work a year looking after them. So OTC products enable self-care for adults and children everywhere, and allow them to treat themselves and their dependents, which means they're able to work when otherwise they wouldn't have been able to. So yet another exciting new statistic for us is the quality of life benefit that using OTC products has on an individual. Again, we haven't had data on this before. So that you can see here, continuing from the consumer personal impact, Frontier have calculated that of the 61 million people that use OTC products, for every £1 they spend on OTC products, they get £4.50 back in quality of life benefit. So across the whole population, this benefit could total nearly £15 billion per year, which is approximately 5 times the amount that consumers spend on OTCs. It's great to be able to think of products in these terms, as we of course know that they provide benefit to those out there who use them when they have those minor ailments and conditions. But being able to quantify that really exemplifies the impact that these products can have on the consumers that buy them. So that's it on the consumer self-care side at the moment. So now we're moving on to the healthcare system impact. So as you can see on this slide, the current information shows that the total yearly quantity and value of OTC products compared to the NHS. So OTCs have a quantity of 983 million units sold per year with a value of £3.3 billion. And that data comes from Nielsen IQ and our PAGB members. And then the NHS figure is for the community pharmacy with 1.37 billion prescriptions dispensed at a value of 12.2 billion. And that covers England, Scotland, Wales and Northern Ireland. So it's interesting to see that whilst OTCs don't quite meet the same number of prescriptions dispensed in pharmacies over the year, in comparison terms, they do meet 70% of the volume versus prescription. Now, if we look at the current savings that the OTC brings us in relation to the NHS prescription and appointment savings, we know that 82% of people who use OTCs would seek treatment if OTCs weren't available. So that's a massive 50 million people out there who would be seeking alternative arrangements if OTCs weren't there. This means that the costs that are now showing on the screen are relating to that 82% of people. So there would be an additional 2.7 billion NHS prescriptions needed if OTCs weren't available. And then if those 50 million people also had one extra GP appointment per year, a quarter of that, 50 million, which is 12.5 million, had one additional A&E visit per year, it would cost an additional 3.7 billion. So therefore, the total savings that OTC products currently make to the NHS is at least £6.4 billion per year. Quite a jaw-dropping figure. So that's saying that if OTC products weren't available in this country, then the NHS would have to find an extra 6.4 billion to compensate for that. One of the other areas that I'm really excited to talk about is the impact of OTCs in preventing more serious outcomes. Again, we haven't had any data on this previously, and it's very easy for people to dismiss the OTC category as not valuable and for minor ailments only, and believe that the critical medicines are those in the NHS. However, this doesn't show the true understanding of the impacts of OTCs in preventing other illnesses, which, if not used, could result in intervention from a doctor or even in worst case scenario, hospital admission, and in some cases lead to life-threatening conditions. An example of this is highlighted in the report and now shown on the screen. So, 12.3 million units of OTC antiseptic creams, liquids and sprays are sold each year. And if only 1 in 10,000 of those units prevented an ultimate outcome of sepsis, it would mean that 1,229 sepsis cases are being prevented each year, which means a direct saving of £4 million to the NHS and an indirect economic saving through the reduced absenteeism and avoided productivity losses would be at 33 million. So this is showing the saving that it's making to the NHS and economy. But actually thinking about the bigger picture, the saving to the patient by not having to live through that traumatic and life-threatening experience is dramatic, and preventing this impact both on their mental and physical health can't be underestimated. A milder version of this scenario includes getting an infection in a wound, which results in a GP visit and antibiotics. This outcome would potentially happen more frequently without antiseptic use, and again result in impact to NHS resources and the consumer, and potentially the economy through lost work. So what this means is that by using everyday products to enable self-care, it results in a better outcome for the person and the patient, prevention of GP visits and antibiotics, and in the worst case scenario, progression to a life-threatening illness, which involves costs of a hospital stay and medication, as well as preventing productivity. This is just one example, but there are many others without the help of an OTC product that could lead to worsening outcomes. Another example includes even simple fever relief can help febrile convulsions in infants. So we've spoken about the current impacts of OTC products in the UK on the NHS. Now we can look to the future, and one example of this is looking at substituting the GP and A&E appointments, which are currently being used for self-treatable conditions, and utilising the existing OTC products out there instead. So this slide is showing that there are currently 25 million GP appointments and 5 million A&E visits by individuals who visited the GP or A&E for self-treatable illness last year. So if these individuals using these appointments instead uses OTCs to self-treat, it could save the NHS £1.7 billion per year. That's 1.7 billion in avoidable NHS costs through greater use of OTCs, as the value of the appointment costs could be avoided. That's £39 per GP appointment and £139 per A&E visit. Frontier Economics have also highlighted that there could be further NHS savings by eliminating any remaining prescriptions of OTCs for self-treatable conditions and from avoiding serious illness from OTC use. So let's just think about that figure relating to the number of appointments and A&E visits for self-treatable conditions. If those people used OTCs instead, it could save the NHS 1.7 billion. What does it mean that they could buy? So you could buy 6 3/4 of the most expensive house here in the UK. So for those of you that have a spare £250 million, you could buy Holme Grange estate in Regent's Park 6 3/4 times, or you could buy 13.5 of these islands off Thailand if you've got a spare £125 million. That's Rangay Island in Thailand. So it just trying to quantify those kind of savings that can be made. But another example, which may be perhaps a little bit more relevant, is that 1.7 billion could pay the salaries of at least 1 in 10 nurses in England for a year. Or it could pay the salaries of at least 3 in 10 consultants in England for a year. So if we look back at the actual figures mentioned, we talked of 25 million GP appointments and 5 million A&E appointments. And those are actually some updated figures from our previous ones that we had back from 2016. Previously, we'd estimated that there were 18 million GP appointments and 3.7 million A&E appointments for conditions where people could have treated for themselves or a pharmacist could have been the first port of call. That cost then was estimated, along with the unnecessary prescriptions for products which could have been bought over the counter, at 1.5 billion. So now we've got some updated figures to replace that information. The savings to the NHS, but the report also highlights another area where there could be NHS savings, as well as more positive outcomes and quality of life benefits for the individual. As the slide shows, 33 million people per year have at least one self-treatable condition they ignore or don't treat. So this means that both industry and potentially the NHS could look further to understand why this might be the case and look at what drives the behavioural change could take place to enable them to treat when it was appropriate to do so. Because in some cases, if individuals use OTCs, they could improve both their quality of life and potentially reduce workplace absence. And again, continuing to look at the potential future savings, we're now going to move on to reclassification, an area which some of you may know I'm extremely passionate about. So it's really difficult to be able to provide an estimate on the reclassification savings, but Frontier Economics have estimated that reducing NHS prescribing by just 5% could mean a saving of 1.4 billion from reclassification. Now, I need to highlight the figure is illustrative and shown in the report, where there is also data for both 1% reduction and a 10% saving as well. What the report is showing is that if reclassification were to reduce NHS prescribing levels and spend by 5%, it could save 1.4 billion in prescription and appointment costs. That constitutes 611 million of avoided prescriptions and 772 million in avoided appointment costs. So again, there's another massive potential saving to be made if we, industry, work with the government, MHRA, DHSC and pharmacy groups to make this happening. However, it's also really important to reflect on something that I'm very passionate about, the widening access for consumers to medicine. I mean, obviously that provides NHS savings mentioned in terms of the avoided prescriptions and associated appointments, but there's actually a bigger public health benefit here. Enabling consumers to buy a wide range of products at pharmacies, which are only 20 minutes walk from the vast majority of the UK population, that's around at least 80%, means that people can access products outside of GP hours and during weekends. Furthermore, some people who currently don't treat illness may also receive a benefit. as some products are actually aimed at the walking well to bring those people either into the healthcare system or provide a better quality of life benefit. And there's a lot more detail on reclassification provided in the report. However, continuing on this theme, some of you may be aware that PAGB is proposing that the UK relook at the list of potential reclassification candidates here in the UK. And there's a lot of excitement around this from member companies to look at new categories and conditions and actives that can be switched. And we're now involved with work with the MHRA, DHSC and Number 10 on this, due to the fact the proposal was incorporated as part of the Primary Care Recovery Plan in May 23. An example of where this can help is given in the report and is now being shared on the screen. So here, this example shows that for female sex hormones and HRT, that 7 million prescriptions were dispensed at a cost of £96 million last year. If the prescriptions were reduced by 8%, it could save the NHS 7.6 million in avoided prescriptions and 6.3 million in avoided GP appointments. So it's easy to see the potential benefits to both the NHS and consumer in widening the access and availability, and which is why I'm personally so excited about this area and the opportunities it can provide, and keen to work with MHRA and DHSC, as I mentioned. So we've talked a little bit about the NHS and the impacts that that currently has and how it works, could potential savings for the future. But now we're going to look at some of the wider impacts for the UK PLC in terms of economic benefits. So let's talk about the workplace absence, which we touched on earlier in the self-care impact for the consumers themselves. But we're now looking at the bigger picture economic impact we can see. So we have 33 million UK employees. And we know that they had, on average, 5 additional days at work as a result of using OTC products, which equaled 164 million days of avoided work last year. Now, when we look at this in terms of the economic perspective, in terms of the UK median gross hourly wage, it means that the saving to the economy is £18 billion per year. Yes, that's it. A massive number of avoided days of work saved each year, with a giant £18 billion of value saved. Again, this is a new statistic for us in the OTC world. So we just talked about avoided absenteeism, which is good news, but how does this impact productivity, i.e. avoiding productivity loss? So Frontier have advised it's difficult to estimate how much productivity is saved via self-care, but it's likely to be significant. And if a UK employee avoided a productivity loss of just 1% a year through OTC use, this is likely to save the UK £9.1 billion in lost wages, which is obviously impactful at the UK economic benefit. They provided an example of employees who currently used OTCs to treat allergies. If instead, because OTCs weren't available, they were symptomatic, this could have a cost to the UK economy of up to 3.8 billion in lost wages. So a really good example of what it means. So now let's look at the economic contribution of our member companies. We haven't been able to map this information to this level of detail before, so it's great to have the information now. And this is basically showing what OTC manufacturers in the UK bring to UK PLC. So firstly, we now have data which shows that the industry provides 10,000 employees directly working in OTC related activities, which was based on a PAGB member survey and scaled up for the whole of the OTC industry. Then we know that these employees were then paid £377 million for working on OTC related activities. And then a further 198 million to 267 million pounds of wages were paid to employees in other sectors whose employment relies on OTC related activities. So then if we look a little bit more detail about the value of OTCs manufactured in the UK and the number of exports, we have the following information. Now, of course, not all our members manufacture here in the UK, but there are a significant number, as the data shows. So there's a 4.3 billion value of OTC manufactured in the UK each year. and there's 2.8 million value of OTCs exported internationally each year. So as I said, this is the first time we've really been able to quantify the impact in terms of economic wages and exports for the UK as a whole. So now let's combine the information we've just shared in the previous slides with some of the data we touched on earlier in the presentation. And we can summarise the overall current impact of OTC products here in the UK. We have 3.3 billion OTC sales revenue. We have our new figure, which is the economic contribution to wages and exports that OTC industry makes, which is 3.5 billion. We have our new figure showing £18 billion value of avoided workplace absence. And another new figure showing 6.4 billion NHS prescription and appointment cost savings. Plus, there is the quality of life benefit for individuals who use OTCs to self-care, which, as we've already mentioned, could be close to £15 billion per year. So now, bringing that together, we can look at the totals of the current and future economic impact, and we can see some pretty big numbers. The current impact is 27.9 billion per year, with a potential additional annual saving of 3.1 billion pounds per year. And when you go back to the benefit to consumers, there's the quality of life benefit of the individuals who use the OTCs to self-care, which is worth close to the 15 billion pounds. So it's really great for our sector and those we work with to be able to understand and see the annual contributions and savings we currently and could potentially bring to the UK. And again, this information is new to us. And a final statistic to support this, and another really exciting one, is it shows the impact in terms we haven't had available for our OTC products here in the UK before. So for every £1 spent on OTCs, it creates an additional £8.40 in economic and social benefit. So this is calculated by showing that every £1 currently spent by consumers in that 3.3 billion OTC market, that the OTC sector contributes £1 to the economy in wages and exports. It saves the economy £5.40 in avoided workplace absence, and the NHS saves £1.90 in prescription and appointment costs, which is quite amazing. And to give this a little bit of context, I found a comparison in another area back from 2020, where in the construction industry, for every pound spent on construction, it created £2.92 value in the UK economy. And we're talking £8.40 for every pound spent. And then if we look to our colleagues in the US, again, just to give another example, in 2022, they have a statistic for every dollar spent on OTC medicines saves the US healthcare system $7.33. And also our colleagues in Australia in 2014 have data that showed for every dollar spent there by consumers on 8 categories of OTC medicines, it saves the Australian economy $4. So we're really happy now that we have data to share in this format and for members to use and quote it in their self-care work. Therefore, as we come to the end of the presentation, I just want to summarise what we've shared. We've provided a series of new or updated statistics which show that OTCs are vitally important to the consumer to enable self-care, the healthcare system itself, and the economy. And without the presence of the self-care OTC products, all of the touch points that you see on the screen would be negatively affected in both personal and monetary terms. Looking to the future, we've shown that greater access to OTC products and widening the appropriate use of OTCs could unlock even more of these benefits. Policymakers should recognise the importance that self-care and OTCs play in the UK today and acknowledge the sizable benefits that wider and appropriate OTC usage could bring. At this point, I'd like to thank Frontier Economics for producing this very clear and easy to understand independent report, which has given us a great overview of the OTC landscape here in the UK and made it accessible to everyone, not just those with an economic background. So thanks to Leap and Nick. So I'd like to thank you for your attention and will now hand over to Dr. Hilary Jones for the panel discussion, where I'll be happy to answer any questions.
Thank you very much indeed, Michelle, for that excellent presentation. Extremely interesting. It's no wonder that several daily newspapers have already written articles based on this report, because it is mind-blowing. Those statistics are completely eye-watering and very, very significant. The savings to the economy, the boost to the economy, the benefits to the NHS in freeing up NHS appointments in general practice and A&E. We don't have to talk, do we, about the crisis that the NHS faces. So this kind of assistance would be very, very welcome indeed. And of course, the benefits to consumers as well. Now, before we start the panel discussion, I'd like to say that we've got Baz and we've got Michelle staying with us for the panel, but we're also joined by Dalip Singh, who's a consultant at Frontier Economics, and Mark Burden, who's a community pharmacist. They'll be joining us. We would welcome as many questions as possible in the half an hour that we still have. So use the Q&A function, please, to send in your questions, and we will do our best to answer them all. To start the ball rolling, I just wanted to ask a question myself about health inequalities and the concern that some people might have about the cost of OTCs being passed on to people who would otherwise get a free NHS prescription. So perhaps I could ask you, Michelle, to start with. What's your view on whether increasing the use of OTC medicines could be viewed negatively at all? For example, could it be seen as moving the cost of healthcare to consumers?
Well, I think it's all about access, but also what we shared in that presentation referred and mentioned about the quality of life benefit for the individuals. And what you saw is that for every £1 that a consumer spends, they get £4.50 back worth in the quality of life benefit. So yes, there may be additional costs, but they're getting much more back through the benefit that they have from it. And, you know, obviously, whilst recognise that these things can be challenging, when products are switched, for example, or reclassified, it doesn't stop them being available on prescription. So for those that can't afford it and can't, you know, want to utilise the ability to access and go to a pharmacy to get those products, they can still go back to a doctor and they can still get them if they get the free prescriptions. I think, you know, what we've shown is that the OTCs play a really vital role for millions of people, with 96% of that population experiencing one self-treatable condition, with 43% actually having more than 5. So ensuring that people have the availability to get to those products is really, really important. And as I said, if they weren't there and suddenly this was all put on the NHS, and for those 43% that have got more than 5 self-treatable conditions, suddenly them going to the doctor, the impact would be massive on an already overloaded NHS.
Thank you. And that statistic that you gave us alone about people using antiseptics and preventing 1,200 cases potentially of sepsis is remarkable in itself when we consider what the morbidity and mortality of sepsis is. Baz, perhaps I can come to you for the next question about reclassification. Michelle mentioned in her presentation that there was a potential saving to the NHS of 1.4 billion if greater numbers of prescription-only medicines were reclassified. Is there an appetite from industry to reclassify medicines, and what are the barriers?
Thank you for your questions. I think as an industry, there's an appetite to reclassify medicines, and we have done it successfully over the last years. We truly believe that providing better access to our products for self-treatable illnesses will improve the quality of life, as well as what Michelle just mentioned. And during COVID, consumers realized that they wanted to take more ownership of their health, and switches can really facilitate this one. I think it would be very valuable to have a list of health categories and medicines that could be potentially switched. We had a list around 2000 that was aligned with the Department of Health and Social Care and MHRA, and I think that's something we could work on again. I think it's a model that has been that we had successfully implemented over the past, and that could really work. So additionally, I think this progress that's currently being made by the MHRA to reclassify the medicines needs to be streamlined a bit better. It's currently very complex. There's no certainty when you start a process like this, because it's changing time over time. So, for example, sometimes the Minister of Health need to provide specific guidance, while the other times it doesn't. So, if we can get a better alignment on that one, and I know Michelle has been working together with number 10, DHC and MHRA on that one, and maybe Michelle, you can give a little bit of clarity in that part.
Yeah, thanks, Baz. Sorry, Hilary, did you want to?
No, did you want to say something further there?
Yeah, I think, you know, I'm really excited to start looking at this list and coming up with conditions and categories that that our member companies can then look to utilise going forward. And, you know, we have started working with MHRA to start looking at streamlining that process as well, because as Baz says, there are a number of barriers within that, you know, we think actually can be fairly easily overcome just by working through and getting some more touch points and processes in there. So it's a very exciting journey, and I hope that one that we can potentially fairly easily utilise. Obviously, some of the switches do take a while to come through. So if we're activating now, you may not see the fruits of the labour for a year, 2 years. But once you get that list and some of the companies can then start exploring, I think it's a real motivator and shows a step change, kind of, and going back to empowering people to self-care.
Super. And I know that based on pharmaceutical markets elsewhere, about 10% of prescription medicines could potentially be reclassified. So that's really exciting and gives lots of potential. Let me come to you, Mark. Are pharmacists ready? Do you have the wherewithal to deal with medicines that are reclassified? What kind of things are we talking about that could help customers?
Thanks, Hilary. Yes, absolutely, we are up for it. And of course, it's not just the pharmacist in the pharmacy who is available to offer advice. Pharmacy teams are highly trained to triage people and signpost to the right service, or to offer advice themselves before referring on to a pharmacist. Being based in our communities, we tend to know the people who use our services, and we can adapt our offer to meet local needs. And you know, in the present times, we are also very, very aware of the cost of living pressures that our communities and our people are under. So pharmacies in England, and there are similar measures in the other home countries. So in England, we already receive tens of thousands of referrals each month for minor conditions. And these could be from NHS 111, from GP practices, or urgent treatment centres. And an increasing number of community pharmacists are now trained as independent prescribers, myself included, which broadens our scope of practice enormously. And NHS England is about to announce some independent prescribing pilots in pharmacies, building on the success of similar initiatives in Scotland and Wales.
Brilliant. Thank you. Now, Lyndon has a question for us. Should retailers adopt a different mindset to prescription-only medicines to pharmacy medicines to ensure widest availability is not restricted by profit alone? Who'd like to answer that one?
Yeah, I'll help out with that one a wee bit. So in terms of profit, and it was interesting that we've had a discussion about health inequalities, and heard some wonderful statistics this morning of the benefit of over-the-counter medicines. But not all conditions actually need to be treated with a medicine. And for some conditions, a medicine would not usually be offered first line. So, for example, a minor eye infection. Hygiene measures would be advised first, using, say, a warm compress or bathing the eye, and only if that fails would an eye preparation be indicated. And home remedies are available. It's another option that people can consider. So, for example, for oral rehydration, people who are suffering from diarrhea, preparations can be made at home quite easily using ingredients found in the household. So pharmacy teams are ideally placed to advise on this. So it's not necessarily all about profits.
Okay. Lorraine Lee has a question. How will, probably again for you, Mark, how will pharmacy prescribing impact reclassification? will there still be a need to reclassify medicines if pharmacists will be able to prescribe themselves?
Yeah, absolutely. That's a really good question. I think where we're going with independent prescribing is to build on the services that we already have. But just in terms of access, patients can walk into a pharmacy. They don't necessarily need an appointment. They can speak to the people on the counter or pharmacy technicians, for example. So yeah, I think for the public to have that ready access is really important, and for us, I think we would love to see reclassification come further. So, you know, the ones that I would like to see expanded is contraception and HRT, as we saw on Michelle's slides earlier.
Okay, super, thank you. Lyndon again, is there a barrier to people adopting more self-care measures? How can we change that consumer mindset from getting free treatment to better self-care? And I'm going to ask you, Bas, about that.
Yeah, so if you look at that one, I think we have done research in 22 with patients, and we found out that 73% believe that GB and A&E appointments should not be used for self-treatable conditions. So there is already this need from consumers. I think 4 out of 5 people believe that they should take more responsibility in their own health in order to ease the burden on the NHS. And we all know the burden is there. So people want to self-care, and they just need to use the tools to support them to do so.
Yes, Donna Rickaby asks a similar question. What can the NHS do to encourage people to self-care? What are your thoughts on that?
They could do a few things on that one. I think they could already provide more technology available at their website with more information to support the health literacy of consumers. We see that still a barrier on access, helping consumers to really understand in this part. I really believe in education as well. The earlier we start with education, people showing people the importance of self-care, and I think the pharmacist is part of the NHS system as well. They play a critical role in this part, and ensuring that the consumer gets the right advice. They know they can get there for this kind of treatments, that they don't first go to the doctor but is thinking through what kind of problem do I have right now. Can I go to my pharmacist, get the right advice? What Mark was just telling us. I think that will really help the system improve the access as well, because the pharmacists are open 7 days a week, is very close by, and reduces the pressure on the system. Thank
you, Bas, very much. Now, I know you've been sitting, waiting patiently, Dilip, for a question to you, and here it is. In his introduction, Bas mentioned that research is independent and robust. I mean, certainly those figures are outstanding and have received a lot of interest already through the media as well as ourselves. Can you tell us a bit more about how you came by those figures? How confident are you that they are accurate and robust?
Yeah, thanks for your question. And yeah, absolutely. I think overall we're very happy that this is a robust and well-evidenced piece of work. I think kind of to the question of how did you come up with these figures and how did we know which figures to calculate in the first place? Our analysis was underpinned by an impact framework that we developed. And I won't kind of flash up on screen now just for time reasons, and it's all referenced in the report, so I'd definitely direct people there. But it's basically a framework which outlines what we think the impacts of OT sector firms in the UK are and the transmission mechanisms through which those impacts are achieved. So it takes the inputs of OTC sector firms, describes what their activities are, what kind of outputs they create, the outcomes that they create, and how that flows through to those impacts. And that all kind of underpins the figures and how we approach the calculations that Michelle went through in her presentation, and how OTC sector firms generate economic impacts through their contribution to kind of employment and exports in the country, the economic impacts due to improved worker health, so that reduced absenteeism benefits, improved productivity, and then the NHS savings, so reduced demand for prescriptions and appointments. And in terms of the data we used, our research was informed by kind of 4 broad sources, all of which again referenced in the report for anyone interested. So the first is publicly available data, so from the NHS, ONS. The second being market research data, so from companies like Nielsen. Third, academic literature, so academic papers. And then finally, data provided by PAGB themselves, which includes independent survey data that's been collected, as well as data from PAGB members. So I think taken all together, we've got this analytical framework and these kind of solid data sources, and we've used all of those to estimate the figures. And as with any kind of analysis of this kind, it's not perfect. There are kind of areas of the work which were easier to estimate and evidence. And there were other areas where it was a bit harder and you had to make certain assumptions. But again, all of these are made perfectly clear in the report and caveats have been made where necessary. But overall, we're very happy that it's kind of a robust and well-evidenced piece of work, and people will be kind of pleased with what they see when they kind of go into the report and look at the calculations themselves.
Well, many of the statistics surprised me, and a bit around the face, really, with some of them. So, what surprised you most when you came up with your findings?
I think for me, it was the extent to which consumers are still currently using GP and A&E visits for self-treatable illnesses. So Michelle mentioned the kind of 25 million GP appointments every year that are used for self-treatable illnesses, 5 million A&E visits, and the kind of the cost that this creates to the NHS, that 1.7 billion pound figure. I think that was kind of really surprising to me, and the extent to which kind of more could be done to kind of make people or push people towards self-care and save the NHS.
Michelle, you probably had your suspicions that there could be huge benefits to reclassification and more OTC prescribing. You know, how did you react to the report?
I was surprised to the extent of some of these figures that we were seeing. I think, as I mentioned, you know, previously we had some data which was talking about 18 million GP appointments, and having seen that go up to 25 really within about a space of 7 or 8 years. And obviously that was direct feedback from a survey. You know, it's quite amazing the kind of the levels, as Dilip's saying. I think probably one of the things that I found, you know, most exciting was the one around the fact that 5 days work a year is being saved by people using OTCs. We've just never had any data like that before to be able to say, well, if people weren't using those OTC products, they would be off work and not kind of being able to function. And I think that was a really outstanding one, which was kind of really interesting to me, within all of that, with all of that information, and then being able to say that means 164 million work days a year, which is then 18 billion pounds. It's just kind of mind blowing. And you know, and I think you know, we do come across people taking OTCs for granted, and when you actually put it in that perspective, it makes you realise that actually the importance of the sector is actually really high. And yeah, the fact that I think it was 1,870 products touch every single person, you know, in the country every minute is just quite astounding when you actually think about it. And sometimes, well, people don't. And so I think it just brings it home of the importance and actually the reliance that's out there, and anything that we can do to widen that access and widen what's out there in terms of the kind of reclassification or getting people to utilise self-care more and have the confidence to do that, I think is really important.
Well, I was amazed by your statistic that 25 million GP appointments could be freed up, and 5 million appointments at A&E appointments could be freed up at a time when, you know, the NHS is on its knees in terms of demand, and you know, people that we're losing from the profession in their droves. This is really very significant. Baz, what was your reaction to the report?
Yeah, so having worked in a lot of different markets, I've seen this discussion quite often, and as we now have the facts behind it. I think we have a different kind of discussion point with the government as well. When everything is under pressure, normally the governments have been looking into different directions to see how to solve the challenges. I think over here we see the opportunity that's there without impacting the people that much, because it really has a positive impact as well, the access for consumers. They have something to work on with concrete facts, and they could explore different directions in the way to face all the challenges right now. So what I really like about this one, we have concrete data, concrete facts as well, showing the benefits and the size. It's massively, if you see all the numbers together, of the impact of OTCs for consumers in this market, but as well, there's still opportunities to improve towards the future, things we could do differently. So I think it will help as well the different parties to look at it, to see what could be the future strategy for the NHS in this market. How can we optimize the usage of the pharmacist in there? How can we look at reclassifications of our products to ensure that we get the best health outcomes for our consumers, and as well giving them the access to the products.
Thank you. And Mark, I want to ask your opinion about the report, your reaction to it, but also since you're already facing less government funding in recent years and more demand, just like us GPs and hospital doctors, can you cope with the extra work that this will engender?
Yeah, so that's a really good question. So Michelle talked about the NHS Primary Care Recovery Plan, and within there is a proposal for a pharmacy first service to be provided by all community pharmacies in England before the end of 2023. It's already happening in Scotland, and I think Wales are pretty well down the track too. And this will allow community pharmacists to provide prescription medications to patients for 7 conditions without needing to see the doctor beforehand. And of course, that comes with new funding for into community pharmacy, which is very welcomed. But not only that, this will bring more people to community pharmacy, and that's good. You know, bringing more people to our service helps us prove the value. And we see cases of all of these minor ailments every day already. So the volume is expected to increase significantly as people can self-refer to the pharmacy first service. So it's a really exciting time. And alongside this, pharmacies can help to widen the choice that people have. I think we've already heard some examples of that. Choice and access are absolutely critical. But yeah, we are very much in that space. That is something that we want to be part of.
Super. Now, just a reminder that if anyone on the podcast hasn't seen the webinar, hasn't seen it yet, the report is available on the PAGB website. You can see in the Q&A function where to be able to access that report. And Michelle, I also wanted to ask you about the barriers. You mentioned the barriers to reclassification. It seems to me that with the authorities that need to be involved in this, the situation up to now has been somewhat slow and somewhat cumbersome. You want to get it streamlined. What kind of pressures, if any, can we put on government and these authorities like the MHRA to get things done quicker so that we can help consumers and the NHS and the economy generally?
Well, I think actually just having some of the information that we've shared today actually will help. We've seen reference to the reclassification work in the Primary Care Recovery Plan, as I'd mentioned, which is great news. And so now I think it's just taking up that mantle and ensuring that we get the implementation that we need from all of that. And I think, as I said, some of these things may take a little bit longer. We can start doing things now, but you won't see the fruition until a year or 2 years' time due to the kind of term to do with the process. But hopefully now with some kind of statistics and information, you know, there's a potential saving of 1.4 billion that can help ensure people's are motivated and kind of carry on looking at ways of streamlining. And we've already begun the work with the Department of Health and MHRA now, and so we're looking to kind of work with them further, both to get this list together that we talked about, but also streamline that process. And so I think the will is there from everybody. It's just making time for that to happen. And I guess when you then can see now we've got these figures and that we're able to share them, that the reasons behind it are actually quite imperative and are all linked together very well. And so that can help focus attention and ensure that we meet that requirement.
Thank you. Now, you mentioned that the money saved could buy 6 3/4 of the most expensive house in the country and 7 islands in Thailand. And I'm sure we can all think of health secretaries we'd like to send to those islands. But where would you just imagine where that money could be spent to benefit patients, consumers, and the NHS generally? Have you got any thoughts on that?
Well, I think as I said in the presentation, we've there's the nurses that it can help support. It's the consultants. We know that for one of the biggest NHS trusts, their yearly budget is about £1 billion as well. So you can just see that level of saving can really it can go anywhere, but hopefully it can go somewhere where it can then really be utilised and ensure that the front line for when it's appropriate for people to go to hospital or need to go to GPs or A&Es, that it's there and functioning, instead of being there and used when it isn't completely necessary, and self-caring could be utilised instead.
Yeah, the mind boggles as to how the money could be spent to benefit the country's health in general. Do any of you have anything pressing that you'd like to add before we wrap? Because we're just coming up to the end of the discussion time now. Any pressing things you'd like to say? In which case, it just remains for me to say thank you all very much, Mark, Baz, Michelle, and Dalip. Thank you for everybody who sent in questions. We know that there are more questions that you'd like answered, and we can certainly do that on the website in the future if you'd like to leave your questions with us, and we will endeavour to attend to those and get replies to you. But I'm sure you've all found this fascinating. The stats are incredible. So thank you, Dalip, and your team at Frontier Economics. Thank you for those excellent presentations. Thank you, Mark, for everything you're doing in pharmacy, and clearly we'll be continuing to do even more so in the future. And so goodbye from all of us, and thank you for attending. Thank you.
Thank you very much.
Thank you.
Thanks.
Thank you all.